Hello and welcome to the NASGP podcast and YouTube channel. This is part of our regular monthly webinar series, and it goes both out live at the moment with live audience and also gets recorded to YouTube and our podcast. And for this episode, I would like to welcome Helen Garr, who is the medical director and a GP, but the medical director for Practitioner Health. And Helen, so I will hand over to you now to tell us what we're going to be talking about.
Thank you. And thank you for those who could join today, and welcome to those who are watching this on catch up. So I've come to talk to you today about what I have learned as medical director at NHS Practitioner Health and what we have learned as an organisation in over 18 years of providing confidential mental health and addiction treatment to healthcare professionals. And we're going to specifically focus on burnout today, which is one of the biggest things that we see in our work at Practitioner Health. So thank you for joining. So I want to start with just getting you to think about, over the last 6 months of your work, what's drained you the most? Now, if you're joining us live, you may want to pop this in the chat. If you're watching it at home, just perhaps jot it down or have a little think about, because when we start to think about the situation we're in, what's leading us to feel how we are right now, can be really helpful to start to name things. So what's been draining you the most in the last 6 months of work? And I can give a good guess, actually. So I want to start by saying, if you've joined us today because you are feeling burnt out, firstly, let me be clear, it is not your fault. So burnout is something that happens to us. It's not a flaw in your character. It's not that you're not resilient enough. It's too much is going on for too long with too little support. And I've heard it said, and I love this phrase, people can only burn in a building or a system that is already on fire. And actually, if we look at the World Health Organization, how they define burnout, so they define burnout as a syndrome stemming from chronic workplace stress that has not been successfully managed. So they entirely see this as a work-related phenomenon. So firstly, if you're here because you're worried about burnout, it's not your fault. And secondly, you are not alone. There are so many studies that have been done and surveys that show that if you are a healthcare practitioner, particularly a GP, then you are at high risk of burnout, and we see high levels of burnout in our GP profession. So I want to tell you a little story about a frog. This is an urban myth you may have heard before. So there is this urban myth that says, if you put a frog in a pot of water, and that water's a nice, comfortable temperature, the frog gets comfortable, but you gradually, bit by bit, turn up the temperature on that pot of water, the frog will adapt its internal homeostatic mechanisms, and it will gradually just adapt. You turn the water up, the frog adapts. You turn the water a little bit hotter, the frog adapts. It gets hotter still. The frog keeps adapting till eventually this poor frog finds itself in a pot of boiling water. So this boiling frog analogy is something you might be able to relate to, and actually many of us can. So you think, we start off enthusiastic, full of energy in our work, full of passion. Actually, as work gets busy, as the heart sink patients with 10 problems, the extra patients on the end of the list, that late night visit requests, covering for colleagues, more and more tasks, blood results, workload dumpings, emails, mandatory training reports, uncertainty about our work, that pot's getting hotter and hotter and hotter, and we just keep going. We just keep adapting and adapting and adapting. We keep working harder and harder and harder, put our heads down and keep going, because that's what we do. And that's what we've been trained to do, until eventually we might find ourselves like that frog in that pot of boiling water. So this might be resonating with some of you. And actually, as we go through this talk, we're going to look at, how do we recognize when the temperature's too hot? How do we recognize if we are in that pot of boiling water? Are we burning out? Are our colleagues burning out? What do we do about that? So how can we prevent it? how might we treat it, and how can we seek help for it? And I'm going to tell you about NHS Practitioner Health, the service that I run, and how we could help. So thinking back over the last 6 months of your work, so we've already got you to think about what's been causing you stress, what's draining you. Think specifically over the last 6 months. Pop it in the chat if you're here with us live. If you're not, just have a think at home. I want to think, over the last 6 months, have you felt stressed due to your workload? Have you not slept as well as you would like due to work? Have you exercised as much as you would like, as much as you know is good for you over the last 6 months? Have you taken on a work-related task in the evenings or the weekends, even checking your emails? Have you ever, over the last 6 months, not taken a break when you really needed to? Have you cancelled seeing family or friends or doing something fun that you know you would enjoy due to work, due to being tired or working late? Have you, over the last 6 months, held off going to the toilet due to your workload? Now, if I had you all in a room right now, and I do this little exercise often, I know the answers to that. I know that many of you listening to this will have answered yes to most, if not all, of those things that I've just spoken about. Now, if you had a friend, a colleague, a loved one, a team member who said, do you know what, I'm working in a job where actually I feel stressed a lot of the time. I'm not sleeping very well. I'm not exercising as much as I would like. I'm working in the evenings and the weekends. I'm not taking a break when I know I really need to. I'm not able to take a break. I'm not spending time with my family and friends. I'm not doing the things that I would enjoy because I'm just so exhausted. Work is taking everything out of me. And sometimes work even comes before my basic physiological needs, like going to the toilet. What would you say? You'd probably say, well, it's time to have a little think about what's going on and how we can rectify these things. This is the equivalent of the boiling frog. This is the equivalent of just keep swimming and swimming and swimming, keeping going no matter what. Now, you don't need me to come on here and say, actually, if we are able to be intentional about the basics, eating well, taking a break when we need to, being physically active, spending time outdoors, spending time with our family and friends, doing things that we enjoy, switching off outside of work so that we can re-energize and restore so we can be our best selves at work. Going to the toilet when we really actually need to go to the toilet rather than just one more thing, one more thing, one more task. You don't need me to tell you that if we were to prioritize and be intentional about the basics, we would be able to cope much better with all the things that have been thrown at us. But what happens is work gets busy, work gets overwhelming. We end up working 5 long days in a row. We end up seeing those extra patients because we don't feel we have a choice. We do all these busy things, but the very things we all know and we all agree we should be prioritizing, like eating well, sleep, switching off outside of work, spending time with family and friends to nourish ourselves outside of work, taking a break so that we can do our work safely and effectively, going to the toilet when we need to, they are the first things we stop doing. The very things we should be prioritizing are the first things we stop doing. We start eating junk food, we stop sleeping, we start working later and later and later, we stop spending time with our family and friends, we stop taking a break. So all that is left is work, and we find ourselves exhausted and at risk of burnout. So I thought it would be helpful just to share with you some of the common signs of burnout that we see. And I've written here the burnout cliff. So you may have come across Dr. Richard Duggins. He's a psychiatrist that works for us at Practitioner Health. He's phenomenal. He's written this wonderful book. I don't know if you can see this, Burnout Free Working. And I'll reference Richard and his ideas a lot throughout this talk. He talks about the burnout cliff. So what we see at Practitioner Health is people, because they're getting their heads down, keep going and going and going, often not recognizing the signs, we seek help too late. And we fall off what Richard calls the burnout cliff. Now, it's much more difficult to pull yourself back when you've fallen off the cliff than to recognize when you're nearing the edge. So common signs that we're nearing the burnout cliff that we see are careless mistakes, drug errors, forgetting to send a referral, not being able to stop thinking about work day and night, waking up in the night thinking about work, dreaming about work. Have you ever done that thing where you wake up and you feel like you've worked a whole shift before you've even started? Conversely, lack of interest in work, really just losing all interest and passion and care about work. Working longer and longer. So that colleague that's getting in earlier and earlier, staying later and later, but actually finding it more and more difficult to make decisions. When we're at our best, we're sharp, we think clearly, we're efficient. When we're heading towards that burnout cliff, we get brain fog. We doubt our decision making. We lose confidence in our decision making. Not being able to sleep or sleeping too much, feeling tired all of the time, feeling constantly exhausted, our immune system drops, catching everything that's going, aches and pains, coughs and colds, frequent illnesses, being irritable or tearful, another common sign. Becoming really quiet is something I hear a lot as well. Cynicism is a big one. And actually the biggest one I would see, which I haven't written on here, and I will add, is compassion fatigue. So when we lose compassion, when we stop seeing the patient in front of us as a person, as a human, when we start to see patients and their illnesses as another thing to do, we lose sight of the human behind the illness. Bad medicine, what do we mean by that? Unhealthy coping strategies. It is human nature to go for the easy win, the instant gratification. So we see when we're burning out, we seek this bad medicine. So taking up smoking, for example, drinking a bit more than we would like, drinking too much, over-the-counter medication that we should, unprescribed medication from the drug cupboard. We see issues with codeine abuse, for example, recreational drugs. Poor motivation to go to work, brain fog and loss of confidence that I've said. You may recognise some of these signs in yourself and in others. And this is the first key thing in dealing with burnout is recognising it. So we say name it to tame it. There is power in simply naming what is going on, being able to recognise and name our emotions. It gives us control. Recognising the signs of burnout is the first step to managing it in ourselves and others. So getting into the habit of checking in with ourselves and with others is really important. So I really love this temperature barometer that you see here, and there's various versions of this around, and this is taken from a website that was actually set up during COVID. It's still active and I like it a lot. It's called wellbeingandcoping.net. And what this temperature thermometer is getting us to think about is to get into the habit of how am I doing? Starting to be self-aware, having that emotion and intelligence about how am I feeling? Because what we see at Practitioner Health is people just go and go and go and go and go and go and go. Give until we crash, until we fall off that burnout cliff. And then suddenly we think, okay, something needs to change here. Yet we know if we start to recognize when the signs are there early on, we can pull ourselves back. So I like this temperature colour continuum. Where are you on this continuum? Are you red? Struggling? Are you amber? Not doing so well? Are you orange? Okay. Or are you green? Are you coping? Are things great? If you're in the green, what are you doing to keep yourself in the green? You're doing something. You might not have acknowledged what it is, but what are you doing? If you've got colleagues in the green, what are they doing differently? When were you last in the green? If you're in the orange, what might you need to do to move yourself back towards the green? If you find you're sitting in the red consistently, you are not alone. If you're sitting consistently in the red, it might be time to think about, do I need some help? How do I get myself out of the red? It's difficult to move yourself from the red by yourself. It's important to get some support if you're sitting in the red. And we'll come on to what practitioner health can do if you're feeling that you're sitting there. Do you have colleagues who are sitting in the red? So in COVID, we did a lot of work around this. I don't know if you remember, we started to introduce across the NHS huddles. We learned from what's done in the military, what's done in the airline industry, these huddles to check in with each other. How are people doing? Am I red? Am I amber? Am I green? How's everyone doing today? What do we need to do to support you? I've heard of doctors who tell me that they've got into this habit of checking in with themselves, and actually they use their iPhones and they go on the calendar on their iPhones, and every day they give themselves a number between 1 and 10 of how they're doing. And then you start to see patterns. What are my patterns? When am I a lower number? Why? What's going on? What was happening that day? This website also gives you ideas of things to do to move yourself towards the green, depending on how much time you've got. I really like it. It's worth taking a look at. So getting into the habit of checking in is a really important tool for preventing and managing burnout. I don't think there's been a single doctor who's come to us at Practitioner Health who hasn't said, looking back, the signs were there. Imagine if we could work out what our signs are before we fall off that burnout cliff. So when we start to recognize our signs, we can name it. To tame it, we can start to control things. So what are your signs? So I would encourage you to think right now, write down 2 or 3 signs when you are struggling, when you are not at your best. So I've done this exercise before, and for me, I know, I'm share with you today, when I'm not at my best, I moan. I hadn't ever realised that I moan a lot, actually, until one of my 360-degree feedbacks when I was a GP registrar. Somebody wrote, moan less, achieve more. It did make me laugh. And I spent a couple of years trying to work out who wrote that about me. But actually, they were right. When I am under stress, when I am moving towards the orange to the red, I start to moan. And I'm now able to catch myself and say, hang on, I'm moaning. I'm moaning right now. That's one of my signs. What do I need to do? Do I need to take a break? Do I need to, do I need to have some time out? Do I need to go and talk to a colleague? I doubt myself. One of my signs is I lose confidence in my decision-making abilities. I start to think I'm a terrible doctor. I doubt what I'm doing, and I can become tearful. I get brain fog. Other people tell me they isolate themselves, they become irritable. So it's worth thinking about, what are some of your signs? Now, I really like this. This is taken from the military. This is the Navy stress continuum. This is given to leaders to recognise how their teams are doing. Now, we won't go into all of this today, but it's worth just taking a look at actually what's in the green column. And I really like what's in the green, having fun. So people who are thriving, people who are in the green, they're having fun at work. And we often feel, Richard shared, and he gets snippy. Yeah, really, really common. Snippy, unapproachable, lacking humour, inefficient, disorganized, as I hear a lot. So what's your green? What when you are in the green, what is it for you? Having fun. Physical fitness on here. So we know that physical fitness equals mental fitness. That's a whole other webinar. I'm not going to spend a lot of time going into that, but we know that physical activity, strong evidence for moving our bodies, for improving our mental well-being as well as our physical well-being. Being motivated, being calm and steady, other areas. Conversely, looking at the red, what are the signs that the Navy look at when people aren't at their best? What are your signs? So it's worth just having a think about your signs. Now, something we do at Practitioner Health that actually we've taken from the evidence is we invite all of our staff that work for us to complete what we call a RAP plan, a wellbeing, recovery or resilience action plan. This is an evidence-based tool to stay well. It was developed by Mary Ellen Copeland. She's an author and a mental health advocate, and it's been used worldwide since the 90s. It's used often in mental health as well, but it's becoming much more commonplace. So we invite all of our team to complete a wellbeing plan. We want to know, as an organisation, how will we know when you are struggling? What are your signs? How will we know when we need to support you? How will we know when you're thriving? Now, completing a wellbeing plan is a really useful tool because, as I say, when we write things down, when we name things, we take control. So you might want to think about completing your own wellbeing plan, and I'll show you where you can get them from in a moment. But the kind of things that are in wellbeing plans are: what do I need to do every day to stay well? What do I need to do less of? I need to do less doom scrolling. What do I need to stop doing to stay well? What kind of things was I doing before, or things that I know might help that I might think about doing? What do I need others to do? And the two questions in the middle are questions I think if you are leading teams or if you're working in a team, but a question I ask often of my team: what can we do to get the best from you? And what might we do that brings out the worst in you? And you can ask yourself those questions because it gives you ideas of what you need to stay well, to thrive. So for me, what do I need to do every day to stay well? So I've got 2 chocolate Labradors, and I know on my wellbeing plan, I need to walk my dogs every day. The days I don't walk my dogs are the days when my days do not go as well, when I don't cope as well as I would like. Yours will be very, very different, but writing these things down can be very helpful. And you may want to share your wellbeing plan with the people that you work with so they are aware of what your signs are. Now, the wellbeing plan we use the Mind Wellbeing Work Plan. The website I gave you earlier on, the wellbeinganddoing.net, they have a wellbeing plan on there that you can fill in. If you have registrars, it makes a really great tutorial. You can put it in your appraisal. It's just a really nice, useful tool to think about doing. It may appeal to you. And then thinking about those around us. So we want to recognise the signs in ourselves, but also in others. Richard's just mentioned in the chat, we're going to put the links to all of these things in the show notes for those of you who are listening on the podcast. So we will put these links in. So thinking about recognizing the signs in others. So we know that when people struggle at work, it's often not work that tips them over the edge. We know that as doctors, we just put our heads down, we keep going. We've mentioned that quite a few times. We keep going often to the detriment of everything else. We're keeping going because we're borrowing from our family, we're borrowing from our social life in order to keep going at work. So often when people crash at work, it's sometimes not work that tips them over the edge. It's what we call secondary stressors, what we're carrying in our psychological backpack, the things we're carrying around. It might be the poorly dog, the children who are sitting exams, the child who doesn't want to go to school, the difficulty paying bills, it might be moving house, it might be relationship difficulties, it might be health issues. So it's often these are the things that we're carrying around that tip us over the edge. Now, we know that when we are able to share what's in our psychological backpack, when we're able to share these secondary stressors and get support from our teams, we are better able to cope. But the only way people are going to feel comfortable sharing what's in their backpack is when we have trust. And the way we get trust in teams is by getting to know each other. So when we take the time, we put the effort in to get to know the people around us that we're working with, sometimes we get to like each other, which is always a bonus, but we develop trust. And when we develop trust, we develop psychological safety, that ability to share what's in our backpack, that ability to make mistakes and know people have got our back, that ability to come to work and know somebody's looking out for us, to take risks, to put ourselves out there, to know if something goes wrong, we're going to learn from this together and make things better. When we've got psychological safety, that's where the magic happens. And we get psychological safety, we start by putting the effort in to getting to know the people around us and looking out for the people around us. So we talk a lot about reaching out, seeking help. It's good to talk. How hard is that? And I'll come on to that in a moment in the second half of the talk when we come on to talking about practitioner health. It is incredibly hard to put our hands up and say, I am struggling. So we want the people to get into the habit of, as well as reaching out, reaching in, reach into our colleagues. How are you? How are you doing? What's in your backpack? Getting to know each other. When we reach in, how are you doing? What do we get back? Well, we'll often get, well, I'm fine. Ask twice. Ask over time. I'm glad you're fine, because actually I've seen things are really, really tough. I'm glad you're fine because actually I had a really difficult week last week. I'm glad you're fine because this happened. I've heard things are difficult. Ask over time. We develop trust by showing we care over time. So reach in, ask twice, ask over time, look out for each other. So we know all the evidence that we have shows us that a sense of belonging in the workplace is the number one factor for high-performing teams, and strong team bonds protect against burnout and protect against poor mental health. How do we do that? How do we develop these bonds in the workplace, particularly if you're working as a locum and you're moving around from place to place? It can be incredibly difficult, and we often see that doctors, particularly locum doctors or sessional doctors, may feel very, very isolated. And actually, when I was a full-time GP before I worked at Practitioner Health, I worked in a very large practice, an amazing practice. We were, it was a phenomenal place to work. But sometimes I could go days without seeing another colleague if I was not intentional about speaking to my colleagues and having a chat with reception, saying hi to people on the corridor. So how do we go about doing that? So a couple of things that I've seen work. Tea breaks. If you work somewhere that has a tea break, the temptation is often not to go. We've got so much work to do, so many tasks to do, so many things to do. We have a 15-minute tea break every day at Practitioner Health, and I don't always make it. Talks like this are great for me because it helps me set my intention to go. The days I do go to the tea break are the best days. I have this connection with my colleagues. We have fun, we have a laugh, we shoot the breeze, we might have a chat about a difficult situation, a difficult clinician, run things past each other. What would you do in this situation? And it's honestly the best 15 minutes. So this is our tea break. If some of you are watching this on the live stream, you'll see our tea break. We sometimes do an active tea break because we recognise the importance of movement. When I worked in one of my GP surgeries in the past, there was my colleague Rachel. She won't mind me mentioning her because she was amazing. So actually often when we look at engagement studies in the workplace, we say, do you have a friend at work? Have you got someone who's, you can have a little vent with, who's got your back, who looks out for you? Rachel was mine. If I was on call, there'd be a cup of coffee on my desk for me, or a little screen message, you've got this, or she'd help me with extra patients. So Rachel was one of my connections. But Rachel came up with this great idea. So in the days pre-COVID, we used to have leaflets, and you might remember them, about choosing your contraception. And on this contraception leaflet was a green light. And Rachel came up with the idea. She cut out the green circle and she popped it on our door because we had fire doors. So our door was shut. So it was really difficult to have these little interactions throughout our day, which we know are so important. And she cut the green light out, the green circle out, and she put it on her door with blue tag. And she said, when that green circle is on my door, that means I'm open for chat. Stick your head in. pop by, say hi, come in for a chat. And it was just such a brilliant concept. We ran out of contraception leaflets, but it was just a great concept. And I tell you that story just to get you to think about being intentional about speaking to the people that we work with, because it's so easy to become isolated. And actually, this is a whole other talk about the power of connection. And we know that when we look at studies on happiness, like the Harvard study of happiness, for example, the number one predictor of happy lives is having close relationships. But we also know that these small little daily interactions with people throughout our day, person who gives us the coffee, the bus driver, the patients that we see, our receptionists, the cleaner, the gardener, that might be doing the grounds where you work, whoever, little daily interactions are also incredibly valuable for our mental health and well-being and help prevent burnout. And then I've put the cup of tea. So a cup of tea solves everything, but we often don't go. I heard of a consultant somewhere that does frothy Fridays with his team after the ward round, takes the team down to Costa Coffee. Everyone has a coffee, it's 20 minutes, they have a coffee together, and it's the most valuable thing they do. And actually, this translates into the evidence. So I would encourage you to find where are your spaces to be with colleagues. So we run Balint groups at Practitioner Health. Balint groups, you can Google Balint. There's a website. We'll tell you if there's Balint groups in your area. Are there opportunities for peer support groups that you can join? We offer all of our staff at Practitioner Health monthly reflective practice groups and individual supervision to psychologically unload the emotional burden of work. And that is incredibly important in preventing burnout. So thinking about yourself, we often think as doctors that, and we work alone, we're making decisions alone, we think we have to go it alone. And we think that seeking help can be a sign of weakness. But actually, we know nobody can go it alone. I don't know if anyone recognises this Wilson from the film Castaway with Tom Hanks. We know that no man is an island. Nobody functions well alone. Yet despite us knowing that, we often feel that we have to. So I want you to think about, well, if you're here today because you're wanting to prevent burnout, or you think you might be on that road to burnout or completely burnt out yourself and you want to know what to do about it. Who is your crew? Nobody can do this alone. If you want to get through difficult times, if you want to thrive and prevent burnout, it's imperative you have a support crew. And that's one of my biggest lessons throughout my life, is actually seeking help, accepting help. They often say in times of adversity, you don't just find out who your friends are, you find out who your friends aren't. So there is strength in seeking and accepting support. And it's something I've always not been very good at. But you need to be intentional about creating your network. Who's your crew to help you get through difficult times? And Richard Duggins, in his book, he talks about head, shoulders, knees and toes. So he talks about who is your person? Who's your head person? Who's the person you go to when you need to problem solve? You need to think things through. Who's your shoulder person? A shoulder to cry on. Who's your knee person? Who do you go to when you want to shoot the breeze, have a knees up, have a bit of fun? And who's your toe person? Who's that person who's going to give you that little kick up the backside, that nudge in the right direction to just support you to know what you need to do? Might be one person fulfills all of those, but recognizing who are your people and cultivating your crew. Now, we need to put the time in. We can't just expect people to be there for us when times are tough. Putting the time in now to cultivate our crew is incredibly important. And I want to share with you another tool that my patients tell me are helpful, that I find helpful, is knowing your spoons. So when we're thinking about taking control, what is within our direct control? We might not always be able to change the systems or the burning building, but we can sometimes control our response to situations. Knowing our spoons. So what do I mean by that? We don't have infinite energy, but as doctors, we live and we work as if we do often. We expect ourselves to be able to do it all. That 12-hour shift, the school run, the packed lunches, cooking dinner, getting to the gym, working on that research paper, filling in our appraisal, doing that quality improvement project, tackling all those emails, keeping our house tidy, being a perfect parent, being a perfect friend, being kind, being calm, being productive, being perfect. But we can't run on empty. And that's where the spoon theory comes in. It's a metaphor. It was created initially for people living with chronic illness, but it's becoming much more mainstream. And you may have heard of it. It's something we can all relate to. So imagine we start our day with 10 spoons, and each spoon represents a unit of energy. So this is about our energy accounting. Every task that we do takes a certain number of spoons. So getting up and getting ready might be a spoon. Doing a full shift at work might be 3 spoons. Being on call, for me, I know for me, being on call, that's all my spoons. If I have a duty doctor day, that's all of my spoons. Going to the gym might be 2 spoons. Helping with the homework, the life admin, the navigating emotions, all of those take another spoon. Now, let's say you slept badly, or you've got a cold, or your child was up all night. Suddenly, you're only starting the day with 6 spoons. Yet you're still trying to do 10 spoon activities. And that's when we break. So thinking about our energy accounting, protecting our energy in order to cope is really important. So I know when I'm on a duty doctor day, that's pretty much all my spoons. I'm not going to try and go to the gym. I'm not going to come home and try and clean the house or work on that project. I know my spoons are all going to be taken up with that day. And I'm able to, it's a cliche, but be kind to myself. I'm out of spoons. But here's the magic bit. You can earn spoons back. Now, it's different for everyone. It might be a walk outside. It might be a 10-minute nap. It might be going to that tea break. It might be doing your garden. It might be asking for help. It might be letting go of your guilt. It will be different for all of us. But you can earn your spoons back. So knowing how many spoons you have, knowing where they're going, and knowing what restores your spoons is a really, really helpful analogy. And it's about choosing wisely, about protecting our energy and knowing where to spend our spoons and investing our spoons in what matters most. So this is a text message from one of my friends, actually, and she won't mind me sharing it, but it did make me chuckle when I got this, and I thought I'll put this and share it with you. So I get my spoons back by walking my dogs, and especially if I do it with friends, it's really important to me. Richard Duggins talks about what are our radiators and our drains. So what kind of things drain us and what kind of things give us back energy. It's a similar concept. So it's just worth just thinking about what is it that drains me? That's probably easy. But what gives me back energy is less easy. And being conscious and intentional about how we get our energy back. And if you remember, I talked about that. We just keep swimming and swimming and swimming, and we don't stop. Often that is at the expense of our family, of our friends. You know, we are taking from those other things that are important to us in life in order to keep going in work until we do eventually fall off that burnout cliff and crash. So switching off after work is something we hear a lot. People find it very difficult to switch off after work. So I wanted to share with you what I like to share, the practical tools, things that you might take away, 1 or 2 things from this talk that you might start doing that we know can make a difference. When we're feeling burnt out, big changes can feel very difficult. So small practical evidence-based tools are often really helpful. So switching off after work, we know can be very difficult when we're burning out, yet we know what we do outside work is as important as what we do in work, because that's what restores, that's what nourishes us, that's what gives us our radiators back. And a key sign of burnout is it taking longer and longer and longer to recover after work. So, you know, spend your whole weekend on the sofa recovering, ready to go back to work on a Monday morning is a key sign that we might be burning out. So I really like this going home checklist from Mind, and I've seen lots of surgeries will print this off, laminate it, stick it on the doors for the exits. So I just want to share this with you. You might find this useful. I like it a lot. At the end of every day, take a moment to think about your day. and acknowledge 3 things that were difficult and just let them go. And then think about 3 things that went well and give yourself credit for that. We don't do that often enough, do we? And that's something I wish I had more time to talk about, the value of positive feedback and praise and telling people when they've done a good job. We all perform, we thrive when we're getting positive feedback, when people tell us we're doing a good job. Then this is important. This is all about neuroplasticity. Choose an action that signals the end of your shift. Can be anything. My action is I hold on to the door handle and I take 3 deep breaths. Your action might be 5-star jumps. It might be having a cup of tea. Somebody tells me they listen to the Archers on the way home. It might be going to the toilet or putting perfume on, whatever it is. You do that action regularly. And when you do that action regularly, you develop a new neural connection in your brain that when you do that action, tells your brain it's time to switch off and focus on the next stage of your evening, the going home, to be present for the next part of your day, to be truly present for the things that are going to restore you. Now, I used to finish work, I used to get in my car, I used to rush home, I used to be thinking about tea, thinking about homework, thinking of everything I've got to do, thinking of all my emails, thinking of all the things that went on in the day and what I might have done differently. And I'd get home and I was stressed and I was like, now I hold on to the door frame, take my 3 deep breaths, and I go home in a different frame of mind. And I do that even when I'm working from home as well. I will hold on, 3 deep breaths. My brain knows it's time to try and switch off. I don't always manage it, but it's a really useful tool to know about. So before I go on to tell you about NHS Practitioner Health, because that's really important, just want you to think about what is manageable for you to either prevent or stop to pull yourself back from that burnout cliff. So what's one thing that you could start to do regularly that would make a difference? And it needs to be manageable. So there's no point thinking I'm going to start doing a park run every week. If actually you're so exhausted, the most you might manage is just walking, from your car to 5 minutes around the car park. So I've just realised somebody's put something in the chat. It's the Head, Shoulders, Knees and Toes, a book. The Head, I will give you all the resources in the show notes and at the end, but it is Richard Duggins. It comes from Richard Duggins' Burnout Free Working book, which we will share at the end, which draws on all the evidence about actually we know that having close connections, having a support network, the evidence shows us will prevent and help treat burnout. So it's about cultivating your crew and knowing who's around you. But I've got other books I will share with you all at the end. So I want you all to think about one small thing, one manageable thing that if you were to do regularly would make a difference. So for me, I started to think about this recently, and I make sure every single day I just have 5 minutes in my back garden with a cup of tea. It's manageable, it's small, I can do that. I have 5 minutes, and especially now the sunlight has come out, depending on when you're watching this back, we've got sun finally, it's March when we're recording this. So before I came onto this podcast today, perhaps previously I might have just rushed from one meeting to this. I just had 5 minutes in the back garden. I'm working at home today, had my cup of tea in the sun, and that's one of my things that energize me. That's one of my 1%. And yours will be different, but it's worth thinking about. So for the last few minutes of the talk, I just want to give you an overview of NHS Practitioner Health. So we've talked about recognising signs of burnout in yourself or others. We've talked about taking control, naming it, and some of the tools we could do to either prevent or pull ourselves back off the burnout cliff. And of those things we've talked about exercise. We've not gone into detail, but we've looked at that stress continuum, eating well, things that are radiators and our drains, are things that energize us, and cultivating our crew, so developing connections. And actually, what I will say on that, when I do this talk, I remind myself of the importance of connections. And very, very often, actually, I'll have had situations where last Friday, for example, a friend had asked me if I wanted to meet her after work to go for a walk and go for a drink in our local pub. And I was really tired after work, really tired. And I picked up my phone to say, I'm too tired, I can't come. And I reminded myself of this talk and what the evidence is. And I thought, no, I'm going to be intentional about this. I don't feel like going, but I know that this will do me good. And actually, do you know what it really did? I only went out for an hour. And I came back and it really did energize me and I felt so much better. And I was glad that I'd almost prescribed myself that hour with a friend, even when I didn't feel like it, because I knew it would work. And it's the same with physical activity. Move your legs, your mind will follow. We know that we might not feel like doing these things, but we all know, we're doctors, we know they make a difference. So it's almost sometimes like prescribing ourselves these things to do to see if they make a difference. So putting your own oxygen mask on first, this is the third prong to our burnout talk, recognizing it, taking control, what actions might we have control over, and thirdly, seeking help when we need it. So there is no shame in seeking help. In fact, the doctors that come to us at Practitioner Health, we know it is the bravest thing they have ever done by filling in that referral form, pressing send. I know how much bravery that takes, but actually the people that come to us, that's a sign of strength. That is a mechanism, a tool. It's just brilliant when people come to us, but I know how hard it is. So putting your own oxygen mask on first is important. And if we can see people before they reach that burnout cliff, the quicker people will get better. And we have a duty to look after our well-being, don't we? We have a duty. If we are burning out, then potentially our fitness to work might be impaired. We're more likely to make a mistake. We're not going to work as our best self. So nipping things in the bud is really important. So NHS Practitioner Health, we are a national confidential mental health and addiction treatment service. And there was a tragic catalyst behind our origins. The seeds were sown in a really heartbreaking tragedy. So this is Dr. Daksha Emson that you can see on the screen if you're watching this. And she was a brilliant, dedicated psychiatrist who struggled with bipolar disorder. But despite her skill and her commitment, the stigma surrounding her mental illness in the medical profession made her feel that she had to hide her condition. She feared judgment from her peers and intervention from the GMC and potential damage to her career. So her attempts to seek help were limited to hurried informal corridor consultations, and she maintained secrecy around her illness, which prevented her from seeking comprehensive care. And she became very unwell, and unfortunately, after a relapse of her bipolar tragically ended in her taking her own life and the life of her 3-month-old daughter. And the inquiry into her death underscored a critical need that healthcare professionals require a confidential mental health service tailored to their own challenges. And we know that there are challenges that come simply by virtue of working in healthcare and being a healthcare professional. And that service became NHS Practitioner Health. So, as I say, we are a free, confidential mental health and addiction treatment service, and we work across England, Scotland, and the Channel Islands. And we are available to anyone in England who faces a barrier to seeking care due to their role, usually around confidentiality, and unregulated healthcare staff in Scotland. So why is it so hard to seek help? Well, we heard about Daksha just then, and actually we know that in healthcare professionals, we feel shame when we are not unwell. We're told we have to be superheroes. We have to be well all the time, aren't we? There is stigma. It's getting better, and that's one of our key interventions at Practitioner Health is to challenge this stigma around seeking help. And the more people who do seek help, the more people who are open about their own mental health and healthcare helps reduce that stigma. We worry about confidentiality. Medicine's a very small world, isn't it? We know each other often, our paths cross. Our workplace culture can make it really difficult to take time off work to address our own needs, even when we are struggling. And we feel guilty, don't we? We feel like we're letting our team down, we're letting our patients down if we need help. when actually we know the exact opposite is true. By seeking help, we are doing the best for ourselves and our patients. So what do we offer? So in short, we are staffed by, we're primarily primary care-led mental health service, and we're staffed by GPs with special interest in mental health. Do also work with psychiatrists and mental health nurses. We offer anything your GP could do, so prescribing, case management, therapy, both in individual and groups, and we run a really successful burnout group that anybody who registers with our service is able to tell us that's what they want to access and can be considered for. We offer inpatient rehab and detoxification for those struggling with addiction. We liaise with the regulators, occupational health and employers with consent, letters, reports, therapeutic testing, and onward referral where necessary. Therapy-wise, we have quite a short waiting list for our therapy, and we offer mainly CBT and associated CBT therapies and brief intervention psychotherapy. These are our 3 inpatient facilities. We've got one in Scotland, one in the Midlands, and one down south. And this is some of our team. And you can see in the lady in the pink is Dame Claire Gerarda, who founded our service. And we believe we're unique because we take confidentiality so incredibly serious. We understand how important confidentiality is for anyone seeking support through our service. So we have a nothing about you without you approach. We offer tailored, individualized care in a judgment-free environment. We get it. All of our staff are highly trained, experts in their field. We understand the challenges that people are facing to come to us. We've got MOUs with all of the major regulators. I'm not going to go into reading this slide, which is essentially for those listening about our specialist role, and that we operate in a unique space, which is the interface in between professional and regulatory environments in which healthcare professionals work. And as I say, we've got a memorandum of understanding with all of the major regulators, which allows us to treat people with potentially referable issues without involvement of the regulator. We know that what we do works. Our outcomes are fantastic. Clinicians who come to us get better quickly, and they often stay well. Doctors are highly motivated and engaged to get better, and we see that. So common questions. I'm not going to open to the floor to questions because I'm aware that this has been recorded, but these are some common questions that we see. Will you grass me up to the GMC? As I said, we've got memorandums of understanding with all of the major regulators. In cases where it may be in somebody's interest to self-refer to the regulator, then we will support with a self-disclosure if that is recommended. We have our own ELA with the GMC. We can have anonymised discussions if needed about situations to see, but in most cases we are able to treat without the regulator being involved. Nobody should be worse off coming to Practitioner Health. Will this be on your record? No, we use EMIS, but we are not connected to the spine. We will not tell your GP unless you give us explicit consent. Aside from the usual caveats, if we think your life or the life of somebody else is in imminent danger, the usual safeguards, but we will always seek consent. And we will encourage you to let us involve your GP because it is in people's best interests to have GPs involved for continuity of care. We're not a crisis service, so if things become reach crisis point, it's always in people's best interests to have their GP involved. Will I be stopped from working? We shared care always, but we are responsible for your health and well-being as well as your patients. And we know that sometimes people come to us and may be so unwell, they feel they're fit to work, but unable to see that. So sometimes we will work with you to say, actually, if you go to work right now, you're juggling too many balls, you are likely to make a mistake, and that mistake could be catastrophic. Nobody wants that. Let us support you to take some time out. I don't think there's been a single person who's ever not come back and said, I didn't realise how much I needed that. You were right. But we know working is important. We know working is valuable. We'll always support people to stay in work safely. You can register under a pseudonym if you wish. People always say, I'm taking up somebody's space. I'm not unwell enough to be here. As I said earlier, the sooner we see people, the better, the easier it is to nip things in the bud. Am I not sick enough? You and 40,000 others are feeling the same. We do not treat eating disorders. We're not an occupational health service, and we are not a crisis service. In the main, if somebody's already receiving care through secondary care, we generally wouldn't get involved unless there was a clear case for added value, because we know that when secondary care are already treating something, we know that there's potential for the waters to get muddied and for care to be diluted. This will go in the show notes, but 2 QR codes for you to be able to download are Managing an Emotions Toolkit and also our Suicide Prevention and Postvention Navigation Guide, which I've personally written, which brings together all of the resources and tools out there, because sadly many of us will be touched by suicide in our career. If you want to read a book, we'll link to these: Burnout Free Working by Richard Duggins, Permission by Dr. Caroline Walker. These are all our fantastic doctors who work for us at Practitioner Health. Claire Gerarda, Beneath the White Coat, and Boosting Your Mental Wellbeing by Dr. Lee David, who works for us, and her colleague Debbie Bruin. We'll link to those at the end. How do you get hold of us? This is our website. Most people self-refer, but you can email us if you wish, or talk to us over the phone. And that brings us dead on to the hour, to the end of our talk. So I want to thank you firstly for all that you do. Thank you for giving up your time to listen today. I hope it's been helpful, and know that we are here if you need us. Thank you.
Amazing, Helen. Thank you. That was so on time. That's incredible. And a fantastic talk. And so yes, if you're listening, everything, if you look in the notes on your podcast app or YouTube, you'll see the links to to all these resources that you've mentioned. So again, Helen, thank you so much for taking the time. Really appreciate it. And see you again soon, I hope. Bye-bye.